Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. And on today's episode, we'll be previewing HIMSS 22. Yes, the fun is back. And today's episode is brought to you by Hitmake. That's our healthcare and IT marketing community. And we just announced the return of our in-person event happening May 9th to 11th in Foxborough, Massachusetts, just outside of Boston. You can learn more at healthitmarketingconference.com. And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 16 years of health IT blog content at healthcareittoday.com. So you ready to go back to HIMSS 6 months later?
I know, it just feels like yesterday we were all together at HIMSS 21 and literally it was. And now we're heading back.
It was 6 months later, but in COVID years, that's 3 years, right?
It's either 3 years or 6 days, depending on which route you take. But yeah, it does seem like we were just together, but now we're back to normal, I guess you can say. You know, it's back in the springtime as opposed to the summer. So, but it does feel a little close.
It does. I mean, I think it will be interesting to see how vendors approach it, right? Because did they just make announcements? Were they saving announcements? Did they not do the announcements in August because it was so early and weren't sure how it was going to go down? Whereas now, heading into 2022, we know that HIMSS held the conference while Delta was spiking. So I mean, I don't want to predict COVID, but it's looking very likely that we should have the event and it will be a good event.
Yeah, definitely. I'm encouraged that we're going to be in person. I think, you know, the one thing overwhelmingly at HIMSS 21 was that how grateful people were to be able to see each other again and you know, fist bump and at least wave to each other, right? And be in the same room to have a conversation. So I think that will carry over definitely into HIMSS 22, where we're just going to see a little bit more of that, right? More people who maybe haven't seen each other for a long time and reconnecting with colleagues and so forth. That was another thing too, right? A lot of people who worked together had never seen each other, hadn't seen each other for years. So I'm expecting more of that at HIMSS 22.
Yeah, there were even some hugs, that was nice. I actually was at the CES conference and I saw someone, I said, do you want a hug? And she's like, for you, yes. But I think for the rest of the conference, she's like, I don't really know these people. So it's fun.
Yeah. Unfortunately, I think one thing for me is, you know, we're still in the middle of the pandemic, right? And we still have a lot of the issues that providers are facing around, you know, canceling or delays of surgeries and some other procedures. So they're still working through the effects of COVID. I don't mean like the actual disease, but I meant the impact it's been having on the provider organizations. So I think it'll definitely be a challenge for a lot of the providers to get away, either because A, they're busy, or B, the optics of going to a conference and still while everyone else is struggling. I just think it'll be tough.
Yeah. I think the optics will be a challenge for some. I think it will be better this year, especially as we start to see, obviously we record this early, but mask mandates are starting to be removed and things like that. So I think that's going to open up the door for some of them. And let's be honest though, like I understand why the optics kind of look bad, and it's probably good that it's not in Vegas this year, because that optics is even worse because, oh, you're going to Vegas to work. And anyone that's been to HIMSS knows that there's a lot more that goes on in HIMSS than even when it's in Vegas. But anyway, the optics are bad, but to be honest, on the other side is, in many cases, now is a great time to come together. You've been through COVID, you've been through surges. Now let's share. What have you learned? What was a lifesaver for you? What technology helped you? How are you implementing technology now to deal with the Great Resignation challenges? So, in some ways, I understand the optics and even budgets, right? There's some budget questions for provider organizations, but on the other hand, now is a great time to kind of coalesce and share what's been learned over these past couple of years around COVID and share that amongst the industry. So, because I'm sure many of these health systems are taking for granted now systems that they implemented to deal with COVID that could be shared with others.
Yeah, let's hope so. I mean, I think also there's a degree, a little bit of fatigue talking about COVID, right? We spent the last 2 years talking about it. I do think that the providers that do come to HIMSS 22 will definitely be talking about cybersecurity, right? That's a big issue. We'll be talking about info blocking and some of those things. But yeah, you're right. I think there'll be definitely some providers there for sure who can make it and who see the value, and hopefully a lot more will be there. But I do also think it's just going to be a challenge given the budgets. But we'll see. I mean, that's the fun. That's going to be the fun part of HIMSS 22.
Well, and I look at it, when I see what happened at HIMSS 21, there was a lot of value gotten by the people that attended. Even the provider ones that were there, like actually they enjoyed it more because they could be more casual, and they had more time to be able to talk to people. It wasn't quite as crazy, you could get a seat, like all of those things. So, I think we'll have much of the same in HIMSS 22.
I think so. I think so. So let me ask you, John. Like, is there anything that you hope, and when I'm talking blue sky here, is there any type of announcement or anything like that that you would love to hear at HIMSS 22?
Yeah, I got two. So I'll throw one, then you could maybe, tell me what announcement you'd love. Here's the announcement I would love to hear. Interop with an EHR is free. Like imagine if Epic, Cerner, Meditech, Allscripts, Athena. Anyway, I'll name drop all the top HR vendors. Throw in some of the ambulatory ones, Advanced MD, Cario, et cetera. Right? Like, how cool would it be if they came out and said, access to your data is free. I'm not going to monetize accessing the data. It should be available and free. And that, not just what was required by information blocking, but hey, our vision is we don't want to make money off of sharing data. We want to make money off of the services we provide, et cetera, et cetera. How cool would that be? And it would set quite a precedent if the right vendor did it.
that would be an amazing announcement if that came to pass. I mean, one can wish, I guess. Yeah, because obviously the business case is against that. but you're right. I mean, it would take a move like that in order to really propel, access to data. Forgetting about interoperability, just accessing the data. Just doing that would be a game changer for sure.
Yep.
I think for me, an announcement that I would love to hear would be actually one around interoperability. Funny enough,
Interesting.
I would love, and this is really pie in the sky, to go, hey, you know what? We're all going to standardize on this. And we've all agreed we're going to adopt this. I know that'll never happen. We've tried that with FHIR. We've tried that with a whole bunch of other standards, but there's just way too many standards in healthcare. I just wish, this year we're going to go, you know what? We've woken up. We're going to all kind of agree to this method and we're going for it. And we've actually made some meaningful progress here. Now, hey, we're getting better, but to me, that would be amazing at HIMSS 22.
Yeah, I saw an interesting comment from people that says it takes about a decade for a standard to become mature. And they went back to the HL7V1, HL7V2. I think they included CDA, and and then they looked at FHIR, right? And they looked at it and said, it takes about a decade for it becomes standard enough and adopted enough to be useful. And we're kind of at that decade for FHIR, right? Like where, it's almost been a decade of working on FHIR that now it's like, okay, now is this opportunity to do it. And in many ways, many companies have said we are doing all FHIR. But unfortunately, some of the legacy systems just don't support it. The data's not made available, whatever. So I think that is the challenge. And could they step up and do that? Yeah, I mean, I think so, but there's so many moving parts.
Well, yeah, and for me, where I was going with that was also other parts of the ecosystem, right? Because when we talk about interop, we a lot of times talk about people who are making apps and EHRs and so forth. But there's also a very different standard for devices, right? Like the way those communicate is non, HL7 today, right? It's in another standard, and so I look at that and kind of go, I wish everybody could talk the same, because then it would be so much better for the devices, for the people working with the EHR, for patients and so forth. It would be amazing.
Shouldn't AI just solve this, right? I mean,
it should. In fact, John, that was my second announcement that I hope.
Okay, let's hear.
It's AI related. I hope or wish that an announcement that would come out at HIMSS 22 would be, hey, we've created an amazing data set that is all encompassing in terms of ethnic diversity, gender
Ah,
diversity, all of that everybody can now use to help train your AI as a basis point. Because we know there's a lot of biased data sets out there, and there are a lot of AIs based on these biased data sets. So who knows who's using what? So coming out with a
interesting.
universally available, kind of like your idea of just no charge to access it kind of data set for AI training would be awesome.
Yeah, I think NVIDIA has something kind of similar to that, where they've done some work in that area. So that, they've made some progress there. I don't, it's an interesting question of bias, right? I'm trying to remember if I heard that, but they've definitely have a data set that can, accelerate your training of your AI bot. So that's interesting. Here's the one that I would love.
Mhm.
Secure text communication, all of those things have become so important and embraced in this kind of virtual world where I don't want to be near you because of COVID, et cetera. And so I would love to see an announcement where all the big secure text players, right? We're talking about Simpler, we're talking about Tiger Connect, we're
Mhm.
talking about, Perfect Serve, Vocera should be in there.
Lumion, yeah, like
Yeah, Spoke, right? I mean, all,
mhm.
all of these companies that have a secure messaging product, if they created a coalition and said, we're going to create a standard to be able to, and maybe it's a fire standard or something else, right? That says we can secure text across all of these major players. Like, how cool would that be that now I can't just secure text between a Tiger Connect community of people or a Halo Health community of people, but instead I could text anyone who has any of these major
Right.
secure text solutions, and that would be cool. I'm sure you'd lose out on some functionality that are very specific as far as, oh, was it red, and some of the smart routing that a lot of these secure text companies are doing, even around schedules or things like that. But like, if there was a standard that would allow you to text and send messages like that across organizations, I think that would be so powerful, and in some ways would create kind of like we have with e-prescription. Of course, SureScripts just did it all on their own, but if we had that across all of them, that would be really interesting, and a coalition like that would be really exciting.
I totally agree with you. That's a world I came from, John, and I'm totally with you on that. I would say an extension of that also would be if you can come up with a standardized message format for the structure of their message so that you could tell if you're like, because we know there are hospitals using multiples of these systems, right? I may have
Yep.
Spoke, I may have Tiger Connect in two different areas. It'd be great if they would send their messages in the same format to a controller. So they go, oh, actually, these two messages are going to the same patient. I won't send it twice. I'll send it together. I'll send it
Mm.
in one. So being able to have messages in standard format, you'd be able to do this a lot easier, which is a huge problem from the patient experience standpoint in terms of like you don't want to get like 15 different messages from your provider from 15 different systems, right? So
And what's kind of cool when you think about that, though, right, is if we created this standard, then all sorts of other companies could start sending messages to any of these companies as well.
right.
And so it's almost like creating an API to access any of these companies, but to do it at scale so that anyone that wanted to send you alerts and notifications, reminders, whatever messages to that, obviously this could get overwhelming. So I think that's some people's fear, but it would open up all sorts of innovation on the communication side of things.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. We're previewing the HIMSS 22 conference coming up in Orlando. And as you heard John mention at the top of the show, we're excited to get together in person with the healthcare and IT marketing community, Hitmake, and that's happening May 9th to 11th in Foxborough at the Meditech Corporate Center. Head on over to healthcareitmarketingconference.com for details. We also announced the opening of the 2022 Medigy Hitmake Awards. There are 50 awards available across 20 categories, and there are awards for provider organizations, health IT companies, associations, nonprofit organizations, and of course, marketing agencies. Go to hitmake.com and click on awards in the menu for details. John, is there anything specifically that you're going to be looking for from a health IT perspective at HIMSS?
Yeah, I mean, I think there's two big topics for me that we've talked about a fair bit on this on this show, but I just want to see, for example, the progression of voice and AI, right? So those two things, and watching those two and their progression, right? So, I mean, we certainly know ambient clinical voice is becoming more popular. There's a bit of a battle between the nuances of the world who are trying to, automate and, the documentation process, but they're also still using scribes on the back end. You have the Sukis of the world that are saying, hey, you just can't do that. That's not possible, or at least, it's a virtual scribe and that's fine, right? But how much of it can you automate versus do you need the human to actually create the product that they need? Suki argues that you can't. And so they're taking more of a templated based approach, but with voice, which is a fascinating way to do it. And so I think though that battle, if you will, and kind of who's adopting what and what have been their results and how has that progressed? Because now we have organizations that have used this product. And so, at HIMSS 22, I want to hear how is it being used? How successful is it? And then how successful are we at automating this, or do we need the scribes, right? So that, that, and then AI across everything, like how is it maturing and where are we seeing it being applied? That will be a fun thing to watch. And then the other one that I would throw out there is how are health systems approaching RPM and telehealth, right? So remote patient monitoring, telehealth, obviously they all threw it up and, did telehealth in the moment, but now I think, 2 years later, we're going to have a much different picture. And I think many of the CIOs we meet with and whatnot are going to know, okay, this is our plan, or here's our strategy for how to approach it, or, hey, we haven't figured out our strategy because there's not a solution, or, it'll be interesting to hear those types of things.
I love it. I love both of those. And I'm anxious to read your stories after him around those two particular topics, especially a voice. I agree with you that it's exciting, right? To finally starting to see that becoming a reality, that something that you talked about for years, right? And it's finally becoming real.
Well, and also voice for accessing the data. I mean, how
Sure.
cool is it? And we've started to see this, right? Nuance has been doing this. I know I was at the Meditech event where they announced the partnership with it and demoed some of this stuff. And I know they're working with other EHR vendors as well, where you could just say, show me the last 3 lab results for Colin and graph them on a chart, right? Like that would change how you access the data. And we know that access to the data is part of that thing that doctors complain about. Oh, there's 6 zillion clicks, right? Because you got a 6 zillion clicks to be able to get to the data. Then you got to graph it and you got to choose which data and all, it's like such a mess. Whereas if you could just say, hey, graph the last LDL results for patient X for the last 6 months or whatever. So that access to data is also another cool piece of that voice that not many people are talking about.
For me, my perennially favorite topic is one that I'm going to keep my eyes open for at HIMSS 22, and that's of course patient experience, right?
Mm-hmm.
To me, there was definitely momentum before COVID hit towards making a real difference in this area. COVID hit, it's obviously on the back burner a little bit, but I'm anxious to see what new technologies, what new ways to engage patients now that we've had to be in a world of RPM and telehealth, what new things are happening in that space. So I'm looking forward to seeing what companies like, Phreesia and Actium, which was formerly Symphony RM, Lumion, Tiger Connect, all these kinds of companies that are in that space to see what they're doing differently, what they're doing new. I think it'll be fun because I'm hoping that that momentum will continue, even though we've had sort of a COVID interruption for 2 years, that we'll see a return to, hey, let's focus on improving this patient experience. I'm also interested to see how that's now going to be incorporated a lot more into the revenue cycle process, right? So revenue cycle experience is a new term that's being bandied around. I'm anxious to see what companies are going to be talking about at HIMSS around that. So companies like Coro Health and others, like what are they going to be doing in this world around revenue cycle experience?
Yeah, does the CIO finally care about revenue rather than just kind of leaving it to the HIM staff or whoever it might be, right? I think it's become a bigger topic for sure. I just wonder, are we at that kind of turning point for patient experience where the health system and the CIO starts to care? Like, is value-based care becoming mature enough? That's the key question for me, because if value-based care becomes mature enough, then you start to care about the patient experience in a very different way. Unfortunately, we kind of took patients for granted for a long time because we could, right? They didn't have choice. They didn't have whatever else, right? And so, it didn't matter too much. But now that, value-based care is there and you want to have a relationship with the patient, you need to motivate them to do certain actions. Like that is what's going to drive real change to patient experience. And the question is, are we at that tipping point, or are we still evolving?
Yeah, I would say, John, we're probably still evolving there, right? Because value-based care, as we know, is not fully established yet.
Mhm.
I still think the tie between patient experience and value-based care isn't quite top of mind with most people. I think I would go much more pragmatic. We have a lot of patients, and I just spoke to Michael O'Neill, CEO of GetWell. He basically called them dormant patients. So these are
Mm.
people who maybe have foregone care for good reasons. Maybe they just like, hey, I'm not that sick. I don't want to put an extra burden on the healthcare system. Or maybe they've had their procedures delayed, or maybe they're just fearful of going into the hospital. But there's this group of patients that are out there that just haven't engaged. So you need patient engagement and patient experience solutions to re-engage them and get them to come back in. So forget about value-based care. Just
Yeah.
thinking from a bottom line perspective and from the health of your community perspective, you got to get these people coming back in. And that's not advertising, right? Like advertising alone is not going to help these people come in. You're going to have to go back and say, hey, based on your condition, based on what we know about you, you really should come back in for these things. Here's what we're doing to keep you safe. Whatever that kind of messaging and whatever that kind of stuff is, you're going to have to do that in order to continue to drive the revenue that you need to keep yourself going forward.
Yeah. And the other thing that's going to drive this is all of this outside competitive pressure from retail care, from the direct to consumer telehealth, the concierge medicine, all of those things, and the millions and hundreds of millions of investment that's happening there is kind of forcing the hand of many providers as well. That says, okay, well, fine. If you don't provide me this great patient experience, I have other options. And so
Exactly.
that's the other one beyond value-based care that we'll probably see play out to some extent at HIMSS as well.
Yeah. And and I'm also, looking forward to just seeing who the new entrants are and
Yeah.
the technology players, right? Are we going to see, Samsung start to get in a much bigger way, and these kinds of consumer and other organizations that we see in other industries? We've seen that trend over and over the years. I think again, even in 21, there was presence from these organizations. So I'm interested to see who else is going to be there from that perspective.
See, I predict they're going to be a little bit of a dial back this year because of COVID, and these large vendors don't want to go big at conferences yet, unfortunately. So I think we may see some announcements. Like I would be cool to see some announcements because if they've been working on it for the past 2 years and they were like, oh, we're going to launch it at 20. And then they're like, wait, no, let's do it at 21. They're like, no, let's wait. So then now like at some point they have to say, we got to announce it, right? And put it out there. So maybe we'll get some announcements. I'm not sure we'll see them so much presence wise. I mean, certainly in the hallways, I think they're going to attend. They're going to want to be part of it. I thought you were talking about more of the startup companies, and that's always one of the pleasures of HIMSS is you go around the periphery and you find the small booths and you see this really novel solution where you're like, wow, that makes sense, right? Like,
Right.
I love when you meet one and you hear them and you're like, oh yeah, like why haven't we dealt with this before? And you're like, that's a great solution. So those startup ones I think are going to be fun to see.
Hey, before we end off this episode, John, let me ask you this. If you were a vendor this year, how would you approach HIMSS 22, given what we know and suspect what's going to be at that conference?
Yeah. So a couple of thoughts. I mean, I think it's going to be a little different, but I would say look at how can you capture the content that you create there, whether it's with a customer, whether it's in a session, whether it's, what you're sharing in your booth. How can you capture that content and make, HIMSS 22 into this great content event for you? Because then you can use that content to send to your email list, to your customer list that you can share on social media, you can share on publications, et cetera. So I think that's, an extra emphasis on the content that comes out of the event from your work at the event and from what you're sharing at the event, so that, other people who maybe just couldn't come for whatever reason, maybe they even got COVID, right? Like we're going to have some of those situations, right? That just the numbers play out that way. How do you share with those people that aren't going to be at the event? Because, it is a good opportunity there to create the content. There's a lot of work that's gone into doing it. So I think that's one way. One other little thought is, I was talking to a company, R0. They do the sanitization of different rooms and things in hospitals and health systems, and they make it safe, right? And they've applied their technology to be able to do that. And they, if you're going to hold a party, why not partner with someone like R0 and have them sanitize your party, right? If you will, right? With the lights that help to make it a safe thing. And they would love that, right? Because it's then a demo of their product, right? I mean, I think there's some interesting partnerships there if you're creative, right? To be able to create a safer space for those that are attending.
Yeah, I totally agree with you there. I think people now have to think about big conferences, whether it's HIMSS or others, as no longer a single point in time event.
Mm.
You've got to think of it as, how can I extend the value of my appearance, my presence at this conference beyond it? And that some of it is related to what you just said, creating content, turning that into something you can leverage throughout the year. Also in terms of just the relationships you forge, right? Like,
Mm.
a lot more forethought has to go into planning. Who can you meet with? I don't think you can leave it up to chance anymore. Like, you're going to bump into somebody at these conferences, right? Especially
Yeah.
given the climate we're in, it has to be much more thought out. Let's arrange to have lunch. Let's arrange to have this meeting. And that way, hey, when I come down here, I've already got 4 or 5 meetings set up. That's going to be valuable, right?
Yeah.
And I know a lot of large companies do that. I think a lot of smaller ones now have to do that as well. And I think it's changing. I think in general, like, with the size of HIMSS, even, especially even before COVID, it was way too big for someone just to wander around. I mean, I know you and I do that, but we have a very different reason for doing that. But
Mhm.
not a lot of people wander around the exhibit hall that much anymore. It's much more focused. Like, I got to go see this vendor, this vendor. Here's 3 I'm evaluating, so I got to go see these 3. So I think you have to account for that.
Yeah.
So what I'm anticipating seeing continue evolution for in 2022 is just less of the, I'll call it the hucksterism, right? Less of the come and draw of the like spin the wheels type stuff. I mean, I'll still be there, but I think it'll be less emphasis on that and much more around, let's make sure we have those prearranged meetings.
Yeah. I was talking to a CIO yesterday and he said, we're tired of being pitched. Like, it was interesting to hear him phrase it that way. Like, oh, I'm just, none of us want to be pitched anymore, but we do want to learn and we do have problems to solve. And we do, and so, don't pitch us, like build a relationship with us. I was thinking of LK at HIMSS 21. They did this, their booth was rocking the whole time, and I asked some of their team and I said, how are you so successful? And, their answer was something to the effect of, we were deliberate in our planning, which is to your point, that we reached out and, this wasn't a surprise, right? It took hard work and the right outreach to really make it happen. And so, I think it is possible to have, a lot of success and build that momentum. And then of course we all know, once you've built momentum in a booth, everyone says, oh, what's happening there? I want to stop by. So, that always works at a conference as well. We want to follow the crowds. There's something about that.
Yeah, I do want to throw in one last little plug for a Canadian company. You mentioned it, I just forgot. So there's a company called Clean Slate UV. They make a UV device that will clean cell phones. And so
Nice.
to your point that you were talking about before, like, why not have one of those things in your booth, right? And just
Yeah.
have people plunk the cell phone down, close the lid, and it disinfects the cell phone. We all have them.
And
Or
then you
have it
have
at your event
2 minutes to
that's
talk with
offsite.
them.
Yeah, there you go. There you go. Hey, listen, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice, engage with the community at healthcareittoday.com, and on Twitter using the hashtag HITSM. I'm Colin Hung with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.